All right, we are live. Okay, well, once again, thank you everybody for joining. My name is Zach Veers. I'm the clinic owner and therapist here in Seattle. And this is the Egoscue Method. We're going to be talking about knee pain today specifically, but as I mentioned earlier, whole body is involved. We're just going to focus a little bit on the knees today, but just know that if you have questions or concerns about other parts of your body, like ask away. Hopefully you'll learn today how it's all connected, and but knees is the topic. So before we get going here, just one more chance. Does anybody have any questions they'd like me to cover? I know some of you responded over email about that, but anybody have anything they want me to make sure I cover today?
I was curious about, oh, sorry, did somebody else have a question? I was curious about how the knee affects like the rotation of the foot, because I feel like I tend to angle my feet out, and it like if I run a lot, then I'll get like sore skin on the forefoot of my feet. I'll get sore skin there, and so I know that I'm twisting. I know that I must be angling my feet somehow, but I know that my feet, and I've heard to push in your toes and then push your knees out, and like my body just doesn't naturally do that. So yeah. I don't know how to fix that. I don't know what would, and I'm assuming it's somewhere in the knees, but yeah.
Yeah, so the direction your knees point is mostly controlled by your hips. So the muscles that originate on your hips, at least,
Yeah, getting the glutes, yeah.
Glutes, hip flexors, adductors, there's a whole balance involved between all those muscles, and they all have to do their job for your leg to track the way it's supposed to. So if that's not happening, your knee could either be turning out or turning in. And that can definitely cause knee pain. The foot also, should point straight ahead. And if it's not, for most people, it turns out. It can turn in. Some people are pigeon-toed, but most of us point out a bit. And so yeah, but they can also be, your knee could be pointing one way and your foot could be pointing a different way. So there's a lot of variations there. And so, but it's all stuff that we can address through, first figuring out what's the position, and then what muscles do we need to work on, what do we need to change to get that to track straighter. So it's not something you would necessarily need to like think about forcefully changing all the time, like when you're walking or running. There are some cues that you can, easy things you can do to try to keep things a little straighter, but it's if you're having to force it and it doesn't feel natural, there's a reason. We gotta change some things in your body so that it does what it's supposed to. So we prescribe exercises to retrain the muscles so that your body moves better. So it's not just a matter of being aware of it and trying to force your knee or your foot to point straight all the time. Let's figure out why it's not pointing straight, correct it with some exercises, and then let the body do its job. So hopefully that helps.
Cool. Yeah, no, that makes sense, because when I try to force it, it doesn't really work very well.
Yeah.
So.
And you can only think about how often can you really be thinking about the direction your foot and knee is pointing, right? I mean,
yeah.
When you're running, if you've got nothing else going on, you can focus on that. But what about all the other thousands of steps you take a day, right? Mm-hmm. So, yeah. Well, good. Was there another question? Someone was trying to chime in?
I was concerned about the hip and knee. Hip and knee how they correlate. Also, my knee pain was on the inside of my knee for years and years. And the last year or two, it's on the outside. The inside doesn't hurt anymore. Now it's the outside of the knee.
Interesting. Yeah. Do you think something changed? I mean, besides the pain? Like what?
I don't know. Yeah. I don't know.
Could be. I mean, we once again, we have to look at the the big picture, look at the alignment of the joint, not just of your knee, but how it's positioned relative to your ankle and then your hip and all the way up. And that will tell us a lot about, you know, why that pain might be there. So without seeing you, you know, it's hard to say, but there's probably a misalignment that's causing that stress to be put on the outside of your knee right now. And so we'll go through, and I've got some slides that'll help you understand like what the knee should be doing, and you know, what are some common problems, and then, you know, what we should do about it. So
Thank you.
I would like to know how effective this is. I mean, like how many of your patients or clients really resolve their issues?
Yeah, well, I think as was mentioned earlier, you know, it only works if you do your homework. So
Right.
depends. The most important thing is that you do your exercises regularly and correctly. And if you're doing that and you're also getting the follow-up attention, you know, working with the therapist to make sure you're doing things correctly, and also to make sure you're doing the right exercises for your body at the time, which will change, then success is pretty high. I mean, it's hard to give a number just generically, but definitely most people. I mean, there's very few cases, I think, where we can't help, some at least. You know, but it kind of depends on how far gone things are. If you come in with, you know, completely bone on bone knee, you know, we can probably make some improvements, but there's only so much you can do. So it depends on how bad things are. But most of the time, you know, as long as you've still got some cartilage left in your knee, you know, we have pretty good success, like with knees and hips, especially, unless, like I said, it's just completely degenerative and there's not a whole lot of space left in the joint. Surgery is sometimes what's needed, but otherwise, pretty good chance that we can help regardless of age. So that's something we'll talk about in a minute, is, you know, your age doesn't have to be a limiting factor. So I work with people from, you know, children all the way up to people in their 90s. So, and everything in between. Yeah.
Thank you. Thank you.
All right. So pain, topic for the day and why you're all here. And what is pain? Well, we at Egoscue view it a little differently than most people do, or most, especially Western medicine at least. Basically, you know, in America and Western medicine in general, we've been taught that pain is a bad thing. It's something that you want to numb, you want to get rid of, you want to shut it off. And it's usually a sign of damage. There's, you know, you have knee pain, let's get an x-ray, let's get an MRI and find, you know, what's causing that pain in the joint, which makes sense, except as we can see now with many modern, you know, technologies, as it's gotten better, we can see in the joint now, we can see meniscus tears, we can see, cartilage loss, bone spurs, all kinds of things now because of this great technology. But it doesn't really tell us why the pain is there. Yes, there are some changes there, but if you actually look at the research now, it doesn't really correlate well with symptoms, meaning someone could have apparently a lot of problems in their knee, and it doesn't necessarily have to cause you pain. So there's people out there with no ACL, you know, they've torn their ACL and they function just fine, basically, or they have significant cartilage loss or meniscus tears and they don't even know it. So, you know, is that really what's causing the pain? And therefore, is having a surgery, for example, to fix that really going to solve the issue? And sometimes, yes, definitely, but there's a bigger underlying issue, which is what caused the problem to be there in the first place, right? So pain for us, I look at it as a warning signal. I'm a car guy, so the check engine light there is a good analogy. It's just your body's way of getting your attention, telling you, hey, something's up. Like, you need to pay attention to this, do something differently. You know, something's not working the way it's supposed to, and doesn't necessarily mean anything's broken, anything's damaged, but it could mean that if you continue on this certain path, that maybe there could be damage. So it's your body's protective mechanism. Now, if we, going back to the check engine light, if we were to just say, okay, let's get rid of the pains, let's get rid of that signal, let's just put some duct tape over the light so we don't see it anymore, right? Well, we didn't really fix the problem, right? We're just ignoring it. So we have a good mechanic would say, okay, well, let's figure out why the light is on first, and then actually fix the problem. So okay, so what is the cause of your pain? Well, these are some reasons that people might blame their pain on. Their age is a common one, the genetics, their job. You know, whenever people talk about their age, I always ask them, well, how old is your other knee, right? You've got this problem on your right knee. It's apparently because you're getting old. Well, your left knee is just as old, right? So it's not really a true reason. I mean, yeah, your body's, you know, there's a natural aging process, but it doesn't have to cause you pain. And, you know, our jobs, our activities, we may have pain in those situations, but ultimately we have to look to the body we're bringing to the job. Sitting, for example, sitting is probably not a huge issue for knees, but stairs may be. You know, that's a pretty common situation. People with knee pain experience and problems is on stairs. And it's not that stairs are bad for us or that you shouldn't do stairs. It's just that, you know, we got to fix the reason the pain is there, and then stairs no longer are an issue. So just trying to get you guys to, you know, realize, and many of you on here know, that we have to address the cause and not just the symptom. That's really what we're all about at Egoscue. So starting to get into what we think the cause of your pain is. This little example is pretty obvious. Like, would you go in? Maybe if you're crazy, but our bodies are just like this house, should be really stable and straight and have a good foundation. When they don't, when they get crooked like this, it causes extra stress on all sorts of parts of all sorts of areas of our bodies, but it also leaves us more susceptible to breaking or having damage. So our bodies are no different. Posture is not just in reference to how we're standing and, you know, chin pulled back, shoulders back, you know, feet straight. That's what most people think of when they think of posture, but it's really the position of all of our joints in relation to each other, and not just when we're standing still, but how our bodies stay in alignment with each other. The joints stay in alignment with each other. You know, I like this example. State of muscular skeletal balance, which protects the supporting structures of the body against injury or progressive deformity, whether erect, lying, squatting, or stooping. So once again, correct alignment so that all those joints support each other and protect your body during movement or holding still. So our bodies are designed to move, basically. You know, we all moved a ton when we were little, when we were kids. We were never stopped moving. I've got a 2-year-old and a 6-year-old, so, you know, I get firsthand experience with that, and any of you with kids can attest, or grandkids. But we were all that way at some point, you know, but we tend to lose it as we get older for various reasons. You know, we have to get a job or we have to go to school, and so we're sitting more. Maybe we still remain active outside of those times with sports or exercise, but we're really not using our bodies for the most part the way they were designed anymore. We're moving in a very limited fashion, right? We have a favorite sport, we have a favorite exercises we do that may work a lot of our body, but it's probably not taking all of our joints through all their design range of motion regularly enough. So as a result, our bodies start to adapt to that. You know, we start to become less flexible. Our posture starts to change. You know, certain muscles start to get weaker. They're not being used enough, right? So, so eliminating the pain, going back to the check engine light, you know, these are some ways that most people unfortunately deal with pain is through pain medication, which I'm not saying these are bad. I'm just saying these are things that help with the symptoms, but don't necessarily fix the cause all the time. So the surgery we talked about, you know, if you're just fixing some damage, but you're not fixing why the damage occurred, then it may not be a good long-term solution. Resting is great. You know, taking a vacation can definitely help, but unfortunately we can't do that all the time. We all have stress in our lives. We all have to get back to work at some point, or taking care of our family or the house or whatever. So, so yeah, we can't just ignore it. And then giving up the sad baseball player, giving up the sport or the things that you enjoy because they hurt. You know, I hear this one a lot, like, oh, I don't run anymore because it was bad on my knees or it hurt my knees, which, you know, running's not inherently bad. It's just, once again, we have to figure out why it was painful for you, what was going on with your body that prevented you from running without pain. And if we can fix that, then there's no reason you shouldn't be able to run or shouldn't be able to do your activity you love, whether it's gardening or even just walking. Bodies were designed for that. Okay, so getting into the posture, we'll talk about what posture should look like, and then we'll show some examples, help you guys practice analyzing that and how it relates to knees specifically. But just overall here, we've got from the front view or from the back view, we can see these 8 load-bearing joints. So you've got 2 shoulders, 2 hips, 2 knees, and ankles. And those should be stacked up vertically, meaning they're right on top of each other. Shoulders can be a little broader than the other joints, that's fine, but you can see in the picture there, everything is centered, right? So they're stacked one on top of the other and also horizontally. So shoulders are level with each other, hips are level with each other, etc. Now the feet and the kneecaps, you'll notice, are pointing straight ahead. So that's going to be important when we talk about knees. And centered spinal column, and really the whole body is centered. We have that line going down the middle. You should have 2 equal halves, you know, right and left side that functionally are the same. It's okay to be right hand dominant or left hand dominant, but the position of your body should be, and the mobility, the strength, the function of all your muscles on one side should be the same as the other. Okay, then the side view, pretty similar idea here. Ankle, knee, hip, shoulder, and the addition of the ear. So that just shows how the head should be stacked over the shoulder, and then the S curve in your spine. So talking about the knee, by the way, I'm going through this kind of quick. We'll get to the fun stuff here in a minute, but anybody have any questions so far? If so, just unmute yourself, ask away. I don't mind at all. We're good? Okay. So the knee, just real basic anatomy here. So you've got your femur, your thigh bone, that's up on top, starting at your hip, it goes down. And then below the knee joint, you have 2 bones, the tibia and fibula. So that makes up your shin. You got the patella or the kneecap on the front. So basically the knee is it's a pretty simple joint in the sense that it functions more or less as a hinge. So it should bend and straighten. Pretty simple. It's not like the shoulder or the hip where you've got a lot of different movements with rotation and abduction, adduction. And so the knee should really only flex and extend. So when it doesn't, so because of, you know, some things we'll talk about in a minute, you know, the position of it, or if the ankle is not doing its job or the hip's not doing its job, and now the knee has to take on other roles like rotation, and that can cause issues. That's when we start to run into cartilage wear or meniscus tears or ACL tears or just arthritis, you know. It's usually because the knee is no longer functioning as a pure hinge joint. We've started to change that, and there's extra forces being put on the knee.
Which is the inside or the outside of that diagram?
So we're looking at the front. So the you can't see my mouse, can you? The fibula is on the outside. So we're looking at a right knee. So the fibula is on the outside of your leg. So that's the outer side. So we're looking at the right. So Does that make sense? Okay. All right. Okay, so now we're going to go over some common postural conditions of the knee, so alignment issues specifically with the knee. So we've got valgus and varus. So this, or in layman's term, knock-kneed and bow-legged. Okay, so, and in the middle there, you've got one of each. Okay, so that's definitely a weird, not as common situation, but it does happen. You can see that he's got, the right knee is valgus, the left knee is varus. But basically, this is just showing how the knee is either going in. So in valgus, knock-knee, the knees are going in, relative to that vertical line, instead of being directly over the ankle and directly below the hip. Now the knee is moved inward. So you can see on our left here, the person, their right knee is more valgus. You can see the knee almost touching the middle line versus the left knee. It's a little bit valgus as well, but it's more straight. The middle one, as I mentioned, both knees are kind of going to the left. And then on the right, we have varus or knock-knee, which is kind of bowed. So the knees are wider than the ankles or the hips. So both of those, either condition, are not great. I mean, once again, it's changing the knee's natural design function and position. And so that can definitely lead to pain. So then we have rotation. So internal and external rotation, so this is the direction the kneecaps are pointing. So we talked about them pointing straight ahead, ideally. Well, they can either turn out or turn in, so twisting. So on the left, we've got external on his right knee that is more turned out. You can see the foot as well is turned out. And then on our right, we have the internal or medial rotation. Sometimes the knee caps are hard to see, but it's more obvious on her left. So on our right, her left knee, you can see that kneecap is pointing in, towards her other knee, basically. So we won't get into like what exactly causes these conditions. It's hard to pinpoint like one specific muscle. It's usually a combination of things, but all of these conditions are typically, assuming there's no like birth defect or major accident that caused some permanent damage. These are all controlled by muscles. So there's just an imbalance in the muscles that is causing the knee to be out of position, is all this is. So it's not a bone issue, it's a muscle issue. Okay, tibial torsion. So this is when the knee and the foot don't point the same direction, basically. So if we look at our left here without the barefoot picture, and looking at, it's easier to see on their left knee, so on our right-hand side. If you look at the knee cap, it's kind of pointed inward a bit, but then you can see the foot is pointed out slightly, or maybe a little bit relatively straight, but definitely compared to the knee, which is pointed in, the foot is turned out. It's more obvious here on the right. The feet are, turned out a good amount, but the kneecaps are almost pointing straight ahead. I mean, so you've got that torsion or that twisting force happening in the lower leg from the ankle up to the knee, so that once again the knee is not a hinge anymore. It's getting twisted because the ankle and the foot and the knee are not pointing the same direction. So common issue there. Okay, last one, we've got forward and backwards movement. So flexion and extension or hyperextension. Flexion being bent, extension being straightened out, but hyperextension just meaning the knee extends beyond what we would consider, normal range of motion. So that's pretty obvious to see there on both of those. So any questions about any of these knee conditions? Making sense? All right. So let's look at some examples now. So this is where you guys will unmute yourselves and chime in, but This is a client of mine. We're looking at the whole body now, not just the knees, right? Because we have to take the whole posture into account. But who can just tell me something that you see on there that looks different or off compared to the ideal that we talked about a minute ago?
Ears are forward.
Yeah, so side view, the head is definitely forward.
Shoulders are forward too.
Shoulders, yeah.
And hips. And then off kilter a little bit towards the right.
Mm-hmm.
Yeah. I mean, his left. Yeah.
Good.
Looks like he's weighted onto his left side.
Yeah, definitely. So he's off center there. His shifting to his left. Definitely. So. Anybody?
You know, I did have a question about bones. So. Yeah. I know that your bones constantly remodel, so like there's, I won't get into it, but I know that there's ways that you can change like your facial structure by changing your proper tongue positioning, you know, for example. So I know that bones aren't necessarily as static as we originally thought that they were. Do you know, like, can bones change, and could that be part of the reason why it takes time to get a little more time to get your alignment back, or is it purely only muscle? You know what I mean? Like, could there be some bone remodeling that happens in addition to that, or is that anything that they even know? I don't even know.
Yeah, that's a good question. I honestly don't know how too much about the bone remodeling and reshaping and how significant that can be in these, you know, bigger, you know, larger bones like your femur or your shin bones and stuff. I suppose it's possible, but I imagine if it would be a long and slow process if it did change. The muscles adapt pretty quick, right? So even within a single bout of exercise, so just doing you know, a few movements, you can elicit a change in the muscles right away. Now it's not going to be permanent, right? But you can affect how the muscles are firing just by stimulating them. So yeah, bones adapt relatively quickly too, as far as, you know, density and things like that. But I don't know as far as like changing shape much about that, honestly. So that's a good point. I think in most cases, like I mentioned, these postural problems are primarily muscular problems, right? It's not, the bones may be, you know, like the varus, the legs and stuff. There may be some misshapen bones there or joints, but ultimately it was the muscles, in our belief base, that caused them to change. So we have to change the muscles to change that regardless, right?
Definitely.
So yeah, hopefully that makes sense. But that's a good thought. I'll have to look into that more. So I think you guys covered all the important stuff here. You know, offset to the left, just generally forward from the side view. His knees point fairly straight, but his feet are actually pretty narrow and his feet turn out. And hips are a little harder to see, but he has a little bit of an elevation on his right side. So the right hip is coming up a bit, and his shoulders aren't quite level either, right? So you can see his right shoulder is down a bit compared to his left. So body's all just kind of trying to stay upright, kind of like that house we saw earlier, right? It kind of swayed this way and then the top swayed the other way. You know, your body's really good at compensating and trying to keep you going from point A to point B, which is a good thing, but it can also cause issues down the road. So, all right, well, here he is just a couple months later after doing some Egoscue. Now, what changed? What looks different?
I can't believe it's the same guy.
I know, right? Well, he has a shirt now, so that's nice. But
his ears and shoulders and hips and ankles are all in alignment.
Yeah, he's pretty darn good, right? From the side view, much better. It's pretty yeah, I mean, his head wasn't even barely touching that red line, and now it's almost right on the hole on his ear. So he changed quite a bit. I mean, that's pretty significant. So, but from the front too, we can see how much more centered he is, right? He's no longer leaning off to his left. So, which means he's using his right and left side more equally, like we're supposed to, right? We're balanced. Right side, left side should both support us. So,
How long does it take for that to feel normal?
to feel normal. I mean, it doesn't take that long. I mean, once you, as your body, and your body's always changing, right? So, you know, you'll do some exercises, your body will change, and it'll feel hopefully good, right? It should feel better. Most of the time it feels better. But it may feel a little odd, you know, because your body's been used to being in a certain crooked position for who knows how many years, right? So it'll take some time to adjust, but in my experience, you know, we're talking a matter of days or weeks, you know, for it to feel normal again. It's not like a long process to retrain necessarily. So, and of course, the important thing here is he did the work, right? This is all some stuff that you have control over. You're doing the exercises, so it's not like you have to rely on anything or anyone else to have this success. You can change your body for the better with the right tools. So, all right, another example here. This client's a little bit younger, but he actually came specifically for his knees. Well, his right knee. And these are before and after, but the before pictures with the lighter shorts. Who can tell me some things that jump out at you that might be why he has pain based on his first picture there on the left?
Feet are going out.
Yeah, quite a bit, right?
Mm-hmm. Mm-hmm.
Anything else?
It's like his head's forward a little bit.
Mm-hmm. Look at the knees, and you know, of those conditions we talked about earlier, how would you diagnose his knee position?
His knees look like they're pointing out, and then it looks like his arches are like collapsing as well.
Mm-hmm. Yeah, good. So external femur rotation, right? The knees turning outward. His right a little more so than his left, and that's actually the side that was painful. So now you can see in his second set of photos with the black shorts, that's pretty much gone now, right? His feet and knees are pointing much straighter and look more balanced as well. So the right and left side look more symmetrical. From the side view, you can see his head, you know, his ear back on that line and his shoulders back too. One way to judge the shoulder is just looking from the side, how much of his back is visible, right? With the shoulder forward, it's going to expose a lot of your back and shoulder blade. When the shoulder goes back, you should see less of that. So you can see that in his example, the arm is resting, you know, further back. So definitely changing his shoulder position too. So he obviously made some improvements here, no longer dealing with knee pain. I mean, it was, I think it was a typical like meniscus tear diagnosis, but just by doing his Egoscue, you know, he was able to get rid of that. And very active guy, did a lot of windsurfing, I think was his sport. So just shows how, you know, correct the body position. You don't have to necessarily have surgery. You can still live an active life. So here we go. Okay, a couple more examples, befores and afters. This is a younger guy, teenager actually. There on the top, his very first photos, just looks depressing, right? I mean, look at his head and his shoulders all the way down to his hips. He's kind of saggy, you know, knees are bent and pelvis tucked under. Just, you can probably guess what he does spends most of his time on a computer. So once again, bodies adapt to what we use them for. However we stimulate the body, it's going to respond. So in this case, his body's adapted to be fit his computer chair, basically. So in the green shirt there at the bottom, we can obviously see a lot of improvements. And can't see his knees because of the pants, but his feet are pointing straighter. You can assume his knees are pointing straighter too there. Shoulders look way better. Head's obviously closer to the line. So now I will say, since he's relatively young, these changes happen pretty quick. They can happen quickly for everybody, but it's just easier when you're young because you don't have as many years of bad habits to undo, right? So he was able to make these changes in a matter of weeks, so okay, here's someone, this is a more extreme example, but I like to show this once again, showing how our bodies respond to what we use them for. So this lady was in our Japan clinic, and I believe she was worked in the rice fields, hence her posture. She's basically bent over all day, and you can see what that did to her body. And on the bottom there, she's much straighter, and that was after just a single session. So a long session. She spent a lot of time on the floor, just letting those muscles release and engage some other muscles to help support her upright. But once again, bones didn't change in a matter of hours, but the muscles did, and as a result, position is much better. So, okay, this is just to show how age, once again, not being a limiting factor, young, middle age, old, however you want to call yourself there. She, on the right there, that's one of my favorite clients. She's I think 80 now. When I was working with her, she was in her late 70s, and she was an avid hiker and photographer, so she would go up, around Mount Baker and things and do long hikes, not just walks, level ground or anything. She was hiking with a backpack, 8-10 miles at a time in her 70s. And she was kind of just pushing through the pain. She had back pain and knee pain. But this is, showing her before and after going through our eight session program. And obviously you can see how much straighter she is, how much younger she looks, and she felt that much better too. So no longer dealing with the pain on her hikes. And then on the left, we've got a younger man who's really active and kind of a physically demanding job. And you can see how forward he is and just how rounded his shoulders are. And so just goes to show how your body's gonna make improvements regardless of your age. As long as you got muscles and a brain that can control them, you can probably make progress. So, okay, so now for the fun part, we're going to stop sharing that, and going to take everybody through a couple example exercises now. Before we do that, I want to do a little brief assessment. So normally if we were in the clinic and we were doing this in person, you were here, I would actually take everyone's pictures so you can see yourself and see what your posture is doing, but can't do that right now. But we can do a little self-assessment. So if everybody could just stand up for a moment, and if you're wearing shoes, take them off. You can keep your socks on, but ideally, no shoes. So we're just gonna stand in place, kind of shake it out, shake your arms out, shake your legs out, and then hold still. Don't look at your feet or anything, no cheating, okay? Just put your feet where they feel is natural for you. And then just gonna stand still and close your eyes so you can focus. And we're focusing on your feet. I want you to notice where you feel the weight distribution. So where is the pressure on the bottoms of your feet? So notice, is it the same on the right and the left, or is it different? Does it feel heavier on one foot? Maybe you feel more pressure on the heels, or maybe more on the ball and toes. You might notice it more on the inside edge of your foot, like the big toe side, or maybe it's out on the outer edges, or anything in between. So just kind of get a little bit of self-assessment there, make a mental note of that. And then if anybody would mind sharing what you feel, where is the pressure on your feet right now? no right or wrong answers here. We're just observing.
I feel it through the heels and the ball of my foot and a little bit on the outer edge, but I feel like practically no pressure in my toes, which I know is supposed to be bad.
Okay.
Yay, I know what we're having.
Good. Anybody else? Oh, you got to unmute yourself.
I definitely feel that my foot on my left side is turning out more to the left, to the outside, but the pressure feels pretty well distributed on both sides.
Good. Okay. But you can definitely feel, oh, your left side's not pointing straight. Okay. June,
More in the heels there.
Okay.
My weight's in my heels, right on both heels.
Mm-hmm. Okay.
Most of my weight's in my heels.
Okay. So I guess I should tell you what it should feel like now that. So that's fine. You know, these are just we're just once again looking for data or information about what your body is doing. With proper balance and alignment, you should feel the same thing on both feet. So same amount of pressure, right and left, 50-50. And the pressure should be pretty evenly distributed between the heel and then the ball of the foot. So that pad, kind of not on the toes, but on the pad of the foot. If this is your foot, you know, this padded part, and then the heel. So 50-50, pretty even across the whole foot, like from the big toe to the little toe. So across the whole thing. I mean, you will have some pressure on your toes, but you shouldn't be gripping the floor with your toes. If that makes sense. Okay. So anything that's different than that, if you didn't feel that, it just means that your posture is a little bit off, and we don't know exactly what right now, but we just know that something's not stacked up the way it's supposed to, and therefore the weight is not distributed the way it's supposed to. So we're just, you can feel if you move around, if you change your posture, it's going to change where you feel it on your feet. So just kind of, that was a little before test. Now we're going to go through a couple exercises. I guess I should have warned everybody ahead of time. We're not going to do anything crazy here, but we do need a couple simple props. So I'm going to use one of these small blocks, but at home you can just use a pillow, just like a throw pillow off your couch or something. And then we'll need a chair or something to sit on, and then a belt. So I have a yoga strap. So if you have a strap, that's great. Or just, you know, like a belt you would wear around your waist, maybe a scarf, you know, something that you can tie. It doesn't need to be stretchy. We actually want it to be, you know, a nice firm belt. So I'll give you a minute to grab those things. We're just going to use them for a couple minutes. Sorry, I should have warned everybody before the class, but.
I was going to say, this reminds me of the scavenger hunts that my kids have to do on their Zoom calls, you know, for school.
Oh, yeah.
Unfortunately, I have a board meeting I got to go to, so.
Oh, okay, Mark.
Thank you so much, and I'll maybe contact you with Suzanne, okay? See ya.
Sounds good, thanks.
Bye.
All right, let me, so we're going to be sitting. But before we sit down, so everybody got their pillow and or belt?
Yes.
Trying to find my strap. Yeah.
Okay, so this thing we're going to do, we're going to stay standing. And can everyone see my hands here? So we're going to take your hands into what we call the golfer's grip, which means your hands are straight, fingers tips are just going to go down. So notice I'm not making a fist, I'm not closing my hands, I'm keeping them open, but the fingertips are going down. The thumbs stay out, okay? So that's the position of our hands.
I did my study on my computer, but it should be open an hour less.
So if you're standing, look at your feet first and make sure that the toes are pointed straight ahead, and you've got about a fist distance between your feet, between the big toes. Okay, so we got that golfer's grip with our hands. We're standing, feet straight. I want you to pull your shoulder blades back and down. So kind of squeeze behind your shoulders so that your shoulders go back. Now don't let them go up to your ear. Keep them down. Think about putting your shoulder blades in your back pockets. So from that position, you're going to raise your arms out to the side. So our arms are straight out, shoulder height, thumbs are pointed forward, okay? And now we're going to make circles with our arms. So keep the arms straight, but circle forward. So follow your thumbs. Think like a small plate-sized circle with your hands. And we're going kind of quickly on this one. You want to go fast enough to feel your body, your torso should be moving a little bit. Okay, so keep circling. We want to do about 40 circles here. Keep going. I'm just going to look at you guys. Nice job. Everybody's looking good. Okay. Awesome. Okay, we'll say that's 40. Okay, bring your arms down, shake it off, give it a quick rest. Now we're going to go backwards. So same thing, same setup, pull your shoulders back first, and then arms up. Now rotate your palms up so your thumbs are pointed backwards, and you're gonna circle the other way. So follow your thumbs backwards like this. Okay, kind of quickly once again. All right, nice job. Tammy, we got a little helper there. Nice. It's getting into it. So count for yourself. We'll do roughly 40 of those. So you're going to feel these in your shoulders. So that's normal if you're starting to get tired there. Join the crowd. Okay. So once you're done with that, good job, everybody. We're going to go to our chair. Okay. Okay, so similar to standing, when you're sitting, we also want our feet pointed to your head. So look at your feet and make sure that your ankle is below your knee. So you've got right angles basically. Now, this is the important part. So notice I'm not actually touching the backrest. So I'm a little bit forward in the chair. There's some space there, okay? Now, from this position, I want everybody to start in a slouched posture. So just let yourself kind of slouch forward. Your back is rounded. Yeah, so just let yourself relax. So that's, right now our pelvis is in a posterior pelvic tilt, or our hips are kind of tucked under, right? Your back is rounded like a C shape. Now I want you to tip your hips forward so it'll look like this. Now notice where I didn't do this, I'm not pulling from my upper back, I'm just rolling my pelvis forward. So what that does, it puts a slight curve or arch into my low back. So just practice that first for me. Just roll your hips forward and backwards. Let me get a look at everybody. So your arms can just hang out in your lap, that's great. Okay. So I think we got the hang of that. So now I want you to stay in that forward position. So you've got a curve in your back, your rest of your spine is pretty straight. Your arms can just relax in your lap. Let's put the pillow or the small, if you have a yoga block, that works too. Put that between your knees and maintain that forward tilt in your pelvis. Keep it tilted. And now I want you to squeeze your knees together. So just press into the pillow and then release. So you do it about 1 second squeeze, 1 second relax, on and off. Now you're not pushing as hard as you can. This is just a medium pressure, all right? But you should feel this, start to feel this in your inner thigh muscles, maybe up in your hips. Keep your stomach relaxed, okay? Don't tense your abs on this one. Let your belly go loose. And the whole time you're maintaining that upright, forward tilted pelvis. That doesn't change. You're just squeezing and releasing your knees together. Okay, so let's do at least 20 squeezes there. Where are you feeling it, June?
Upper thigh.
Okay, on both legs or just one?
Both.
Okay.
But mostly my knee that hurts. The right knee, yeah. Interesting.
It hurts your knee more when you squeeze, or you mean it?
No, that the muscles it's working more on the knee that's sore for me.
Yeah.
The painful knee.
Yeah, so one purpose of this exercise is a couple of things. One is to get the hips to be in the good position, meaning we've got that tilt in the pelvis, we're engaging some deeper muscles, your hip flexors primarily, and then your inner thigh muscles is what's squeezing the block. But we're trying to restore, if there is an imbalance, like it sounds like in June's case, right and left side are not doing the same thing, right? Her right side, she feels it a lot more than her left, even though they're both moving. So that tells us, you know, maybe one side is weaker or one side's not used to using these muscles like this. So the more repetitions you do, you should start to feeling more balanced, meaning the right and left side should eventually feel the same, or should at least get closer to feeling the same.
Oh, yeah, I did the whole thing.
So,
No problem.
anybody feeling anything other than their inner thighs or groin area?
I noticed that like I tended to just like pull my toes up at first. I didn't realize I was doing it until I consciously.
Like,
And then I was like, oh, okay, like let my toes go down. Like I'm pulling them up. And I know that it feels a little bit more challenging when doing the squeezing to keep your low back in place.
Yeah. Right. If you were to just let yourself slouch, it'd be a totally different exercise. But it's really important to get that tilt in your pelvis because we're engaging and kind of stabilizing, you know, getting a nice stable position for your hips and then going from there. So
I feel it in my right gluteals.
oh, really? Your glutes. Okay.
Now, when I'm moving forward and squeezing, I'm using my abs. Is that wrong?
It's not wrong. It's just your body's, you're trying to figure it out still. So let's keep yourself tilted forward like that. The position looks really good. So when you squeeze the is that a foam roller? It looks like.
Yeah, it's a foam thing.
Yeah, great. So just as you squeeze that, do you feel your inner thighs working at all?
Yeah.
Okay, good. Can you just hold that position and relax your stomach?
They seem to want to work together.
Yeah, that's okay. That's normal for the abs to try to do more than they're supposed to. The abs really shouldn't be working to squeeze a pillow between your knees, right? It doesn't make sense. But, you know, our bodies learn to do funny things. So with repetition, the more you practice it and, you know, just be really mindful of going gentle and trying to relax your abs over time, it'll start to feel more like it should. But sometimes it helps also to come out of the position briefly, like let yourself relax, slouch, maybe wiggle around a bit and then go back into it and just kind of reset. And that might help get it firing in the right place. But okay, so I think we've all done enough of those. So now we're going to take our belt or strap. We can put the pillow down and we're just going to put that around your knees. So now we're doing the opposite. So it'll look, you can put it on your thighs just above your knees. And you want, you know, once again, about a fist width between the knees, okay? So your legs should be parallel, so make sure your feet are on the ground just below your knees. You're not like spreading your feet out wide or anything. Okay, so we're gonna do the exact same thing we just did, but now you're pushing out instead of pushing in. So start by rolling your hips forward, get your back up straight, relax your shoulders, relax your abdomen, and then press your knees out now. So you should feel that more on the outer part of your legs and outer hips. But same tempo, squeeze or press and release, press and release. Okay, let me get a look at everybody. Okay. Good. Looks like, where's everybody feeling this?
My hips.
Good. It's right where we want it. Okay. Remember, keep that arch in your back. If it's hard for you to maintain that curve, then just take a quick break, you know, let yourself slouch, stretch or wiggle, whatever, go back into it. If it's hard for you to maintain that upright position, that tells us there's definitely a weakness there in some of those deeper hip muscles. Or you may, if your back is fatiguing, it means your back's trying to do all the work and not your hips. So, you know, I picked these exercises. They're just kind of generic. It's not going to fix everybody's problems. I'm aware that we all have different postures, and the knee pain could be caused by a whole lot of different things. These are just a few things that generally will help to restore some balance to your body, and will help with a lot of knee issues. But just as a caveat, you know, these aren't like, this isn't medical advice or anything, but just to give you an idea of what Egoscue is about. So
should the feet be doing anything on that last exercise?
just staying on the floor.
Okay, because I felt I was sort of pressing down with the outside of my feet.
Okay. Well, when you push your knees out, you might feel, you know, because your knees are going out, you might feel the weight shift in your feet to more of that outer edge. And so I guess some of that is normal, but you don't want to be pushing so much that you're like lifting your big toe off the ground or anything like that. Okay. So you've all done at least 20 of those, I assume. So let's take the belt off now and stand up. Shake it out. Let's go back to just a relaxed standing position. Close your eyes again and check in with your feet now. And just kind of notice where your weight is settling at the moment. And who feels something different than they felt, you know, a few minutes ago.
I feel that my left foot is straighter, and when I look down, it is. It's not going off.
Awesome. Yeah. Isn't that cool? It's pointing straighter, and you're not because you're like forcing it, right? It just feels naturally like it wants to go there, huh?
It's my weight's more in the center of the foot instead of on the heels.
Good. Who said that?
June.
June. Okay, great. That's good. So more balance from front to back, it sounds like. Anybody else?
Mine's about the same.
Okay. Where is that?
Not evenly distributed between the ball and the heel.
Oh, okay. Yeah. So you were pretty good there to begin with.
My right foot points out normally, and it still is.
Okay. So it just means you need a little bit more work then, or maybe a different exercise. Okay. So that's good.
I have pretty serious balance problems, and I feel much more steady than I did before.
Oh, wow. That's great. Yeah. Well, you should feel, I mean, does it make sense why you would feel more balanced or more?
Well, I think because my weight is evenly distributed.
Exactly. Yeah.
Or I was kind of wobbling around trying to keep myself upright.
Yeah, that's, we didn't even talk about that, but just the balance of your alignment, meaning how the position of your body will definitely impact your balance, right? Your ability to stand up and balance on one leg and all that stuff. So that's great. Yeah, definitely, especially as people get older, I know the balance and the fear of falling is a big thing and a real problem. So we see a lot of kids.
I also have peripheral neuropathy, so that's added.
There you go. It makes it even tougher, right? So yeah, well, that's great. If you can do a few simple exercises and feel more steady, that's awesome. So awesome. Well, good. So that's just, you know, 3 pretty generic exercises that weren't necessarily targeted toward your specific body, but imagine what it would feel like doing, you know, a full routine of exercises that is addressing your specific needs, right? So just show how quickly your body can feel more better, balanced in your feet, more equal weight distribution because your posture shifted, right? Whatever was going on with your alignment is now a little bit better, and therefore you feel more even on your feet. So, and hopefully, if you did have knee pain, you know, your knees probably feel a little bit better too because they're in a better position. So,
The one, can you hear me?
Yes.
The one where we held our arms out and did that golfer's.
Yeah, the arm circles.
How is that just a general balancing, or how is that helping the knees?
Yeah, good question. So yeah, it's a I mean, it affects the whole body. It's primarily, obviously we're moving up here at the shoulders and arms, right? But the response is going to happen all the way down into your feet. So you may have felt how with that quick movement, your spine, your and then all the way down into your feet have to work a little bit to keep your body, from falling over. So there is kind of a stimulus to the whole body, but it's also from a posture perspective, most of us have some kind of dysfunction or a compensation in our shoulders and upper back, meaning like our shoulders are rounded, our head is forward, maybe we're twisted a little bit. So that's just a quick, easy exercise that can help improve some of those conditions. So it's just by, improving your upper body, it can help, distribute the weight better and reduce the stress on the lower body. So that's why I did that, just because everybody, you can pretty much guarantee everyone in this room right now has some kind of shoulder or upper back problem. So we're just treating the whole body, right?
Okay.
Yeah. Okay, so I just got one more slide to show you guys with as far as what your next steps can be. So let's go back to this. Oh, I need to share my screen. Okay, so the next step. So at this point, you could be still a little skeptical, and that's fine. I was, skeptical at first myself. I'm the kind of person who likes to, research things and find out, all the facts and data and analyze stuff before I make decisions. So maybe that's your case too. I think the best place for you to get some questions answered about the method and how it works and why and is to read the book Pain Free. So that's written by our founder, Pete Egoscue. So no better place to learn about this method than by the founder himself. So and honestly, whether you're new to this or not, I recommend everybody read that book. I mean, clients as well. It's called Pain Free. It's one of the best selling, kind of self-help pain related books out there. You can find it on Amazon for like $10 or $15. So that's an option for you if you just like to get more information. Now maybe this made sense to you. You felt some changes in those exercises we did. You kind of read, maybe saw yourself in some of those pictures we shared, and it kind of is making sense, but you're still not quite sure what you want to do about it, or maybe you've got other issues, that we didn't talk about, and you're just not sure if this is the right fit for you. Well, I'm happy to sit down with you on Zoom like this to go over your specific situation. We can look at your posture too, so we can take your pictures. Or you can take your picture and email them to me, and then we can go over that together and really see, okay, this is what your knee's doing, or this is what your hips and your spine, your feet, whatever, and get a better picture of what's going on with your body. So that's free. So I'm happy to do that, half-hour consultation with you just to get more information and help you figure out what you want to do next. So just let me know if you want to do that. Now, the last option is if you're, Egoscue seems like the right fit for you. You're excited. You know that your body can heal. You've been looking for an answer. You're tired of dealing with the pain. You want to do something about it, and you feel like Egoscue could be the right thing for you. Then I recommend scheduling your appointment to go over, at first assessment, and then get started with our therapy program. So just like we've been able to help those other people in the before and after photos, you can experience that too if you're doing your exercises and getting the follow-up sessions you need to progress. So how that works is, in the sessions, we analyze your posture first. We also look at your gait, so how you walk, how you move, figure out what your specific problems are, and then we can tailor the exercises to your body. So no two people are the same, no two knee problems are the same, so we have to look at the individual and what you've got bringing to the table. and it's tailored to you and your time frame, your symptoms, your activity level, your whatever. So it's a very customized, one-on-one approach, and that's how we get the best results. So we typically meet on a weekly basis in the beginning, and once you're feeling better, your posture is getting better, your symptoms are better, then we start to space the sessions out, and give you more time on your own, and ultimately get you to the point where you're no longer in pain and you're doing the things you want to do and just maintaining at that point. So we have a couple different package deals if you want to do that, and we're offering a 15% discount for you for joining this class as a thank you. So if you want to do that, the price is there. We got our 16 session package, and you can see the normal price, $24.95 crossed out. That's the $21.20 is the price with the discount, and the 8 session package as well is discounted 15%. So we package it that way just because, it's a process dealing with these chronic issues. It's not going to change overnight, but it will change with the consistency like I talked about. And most people within 8 sessions are going to feel some definite improvements. Our 16 session package is the most popular or most common one, just because that really gives us enough time to get you out of pain usually and on to the next phase, which is the strengthening and then the maintenance. And it's just a cheaper rate per session that way. You can also share that package with friends and family. So if you had someone else you wanted to go in on it with, you can get a better deal that way. So if that sounds like something you want to do, you can email me or call me. Just let me know sometime before the end of this week, and we can get you on the schedule. You don't have to come in before the end of the week, but at least get on the schedule in the next few days, and then we can give you that discount. So does anybody? That's it. Does anybody have any questions for me now? Open it up.
How does this go with Zoom?
Yeah, well, it works just like it is now. It's best if you have a laptop. So like I've got a laptop, so I can just move this around and show you things, and you can do the same. So if you're doing your stretches on the floor, for example, I'll just have you usually put the laptop on the ground next to you so I can see, or maybe up on a desk or something. So as long as we can see each other, it works fine. The Egoscue method is all based on movements and stretches, so we don't have to physically touch. So as long as we can see each other, it's just as effective. We've been doing it on virtual platforms for years. It's nothing new to us. So we just do more of it now because of COVID, but it's a pretty well established practice. So. Yeah, and I should mention the prices are the same whether you come in person or do it on Zoom. We spend the same. It's usually an hour-long appointments, and then results are the same. Everything is the same, just from the comfort of your own house. So, all right. Any other questions?
Yeah, I have a question. Is this approach appropriate for someone who's kind of under the Ehlers-Danlos umbrella and has loose ligaments?
Yeah. Sorry, who was asking the question, by the way?
My name's Deborah, and I don't have any visual capacity.
Oh, okay. Deborah, nice to meet you. Yeah, I think I've worked with several people with that condition. So it's basically, for those of you who aren't aware, it's it can manifest in lots of different ways. From what I understand, some people are affected differently, but it's basically lax or loose connective tissue ligaments. Are generally hypermobile. So yes, it can definitely help, because in that situation, I don't know about you, but typically, the joints are painful and maybe not as stable as they should be. And so by creating better balance, better alignment through the muscles, we can provide more stability. We can provide better balance so that there's less stress on those joints and muscles. So yeah, it's definitely something that can help. It's not that it's going to reverse that diagnosis per se, but it can help you manage it much better through gentle movements and things that are going to give you some more stability and strength. So, yeah.
Okay, thanks.
Mm-hmm. Great question. Anybody else? All right. Well, thanks again. Sorry we went a little longer than I was expecting today, but I will be emailing you guys as follow-up. So if you have questions you want to ask personally, you can just reply to my email or give me a call. And I'll be sending out the recording of the class as well. So if you want to rewatch it or go over those exercises again, you can. But thanks again, and I will sign off here and make sure there's no questions in the chat. Just thank yous. Okay, great. You're welcome. All right. Well, I hope everybody has
Thank you very much. That was interesting.
Thank you.
You're welcome. Yeah.
Oh, thanks for taking your time, Zach. I appreciate it.
Mhm.
You're welcome. Thanks for joining.
Gotta go. Thank you very much.
Thank you.
Thank you.